make sure you guys pay attention to it. So we are going to discuss about the physiology of cardiovascular system, uh, the anatomy of cardiovascular system, as well as the pathologies or associated diseases with the cardiovascular system. So what makes our cardiovascular system? Basically, our cardiovascular system is made up of heart, blood vessels, which include arteries, veins, and capillaries. Okay, so sometimes cardiovascular system is called blood vascular or simply circulatory system. It consists of heart, which is mainly the pumping device, which pumps the blood throughout the body, and a whole network of blood vessels through which blood is pumped throughout the body and then returned to the heart again and again. So this is how this cycle goes on. So the main purpose of cardiovascular system is maintaining homeostasis, depending on the continuous and controlled movements of blood throughout the blood vessels, which include arteries, veins, as well as capillaries. So homeostasis means maintaining the internal normal environment with respect to the external environment, which means cardiovascular system is responsible for maintaining our blood pressure according to the needs of body. For example, when we eat food, our digestive system needs more blood. So our circulatory system or cardiovascular system readjusts the blood flow in a way like it reduces the blood flow to skin or to the periphery and increases the blood flow to the digestive system to digest the food. So there is there are major blood vessels, major arteries, and major veins which branch out to become small and small and smaller at the end and turn into capillaries. Capillaries are basically the junction of arteries and the veins. So it's the point where an artery ends and where a vein starts. So there are a lot of blood vessels in our body, arteries and veins. Major of them and most of them are named. So the main one that branches out from directly from the heart, the major artery, that is called aorta. The major vein that uh, collects blood from our peripheries and supplies back to the heart, that is called vena cava. Okay, let's move to the next. What is heart? Heart is basically a muscular organ, just like the other, not exactly like the other muscles of the body. It's self-excitatory muscle, which have properties of both skeletal muscle and smooth muscle. We have biceps, triceps, our pec major, pec minor, and other muscles of quadriceps and calves of the leg. So these are all the skeletal muscles, but heart is a bit different than skeletal muscles, but also uh, uh, it also resembles to the skeletal muscle and smooth muscle as well. So our internal body organs such as our stomach, our intestines, so all of these internal organs contain smooth muscles. Even the blood vessels contain smooth muscle. So heart muscle is kind of unique one. It have properties of both skeletal muscle as well as smooth muscle. So it's a third type of muscle. So it's a muscular heart, the main organ in the cardiovascular system, which is very vital for the life. That makes sense. So uh, it pumps on like on a regular interval, or I would say in rhythmicity with the nerve impulses traveling from the brain to it, and then it rhythmically contracts and relaxes, providing blood throughout our body, throughout the peripheries, throughout our brains, throughout our legs, throughout our internal organs, throughout our arms, fingers, everything. So what is the location of your heart? Your location, mostly your heart is located on slightly left side of the chest and a bit deviated one. So it's almost on the level of fourth and fifth intercostal space, which intercostal space means the space in between your ribs. So if you start counting ribs from your clavicle, which is collarbone, downwards, then you will reach your fourth and fifth intercostal space. Then there you can auscultate your heart by the help of stethoscope very easily. Even if you place your hand on it, you will feel the strong heartbeat. Okay. So heart sits between your lungs. Basically, the right lung is on its right side of the heart, and the left lung is on the left side of the heart. So heart sits basically in the left side in the lower part of the left lung, and our chest cavity, which consists of our ribs and the muscles of our chest, it protects our heart. So shape. So basically, heart is not like the emojis we see in our daily life, and the way artists make portraits of it. So it's completely different than we uh, grew up imagining it like. So it's basically trigonal, or I would say with this almost circular base and pointed tip, or that is called apex of the heart. So it looks like a bit upside down pyramid with rounded edges. Uh, with the large blood vessels go into and out of your heart to bring blood and into and away from your heart. So that is where the blood vessels mainly exit and enter the heart, and they branch out eventually to form smaller and smaller vessels. So they connect your heart to the rest of your body, which supplies with blood and oxygen. So the main purpose of our circulatory system is to provide, and like its main work is logistics, which mean providing nutrients of all kinds, different gases to the all tissues of our body, and in return collecting the waste of our cells. So, which means when we breathe in, our circulatory system around the lungs collect oxygen from our lungs and distribute it throughout the body. And from the cellular respiration and from our respiration, all the carbon dioxide that gets collected as a waste, it gets into our circulatory system, and circulatory system of our lungs then push it back to the air. So we inhale air with more oxygen, but when we exhale, it contains more carbon dioxide. So what are the parts of heart? So basically, it's more like a chamber with walls and small cavities that we name as chambers. There are valves, there are blood vessels that connect, that directly enter and exit. There is an electrical conduction system. So this is a diagram of the heart, uh, and these two spaces are called ventricles. This is right ventricle, and this space is called left ventricle. So basically, this heart is cut longitudinally, making it half from like front and back. So these two are the ventricles. Then this cavity is called right atrium, and this cavity is called left atrium. So this major blood vessel that pours blood into the heart is called vena cava, which is superior vena cava. Then this U inverted U shape are blood vessel that directly exits from the heart, and it distributes oxygenated blood throughout the body is called aorta. So what is the difference between oxygenated blood and deoxygenated blood? Oxygenated blood is when the blood is purified through the lungs, and carbon dioxide is removed, and it is loaded with the nutrients, and it is loaded with the oxygen and hydration. That is called oxygenated blood, which means it is carrying more oxygen. Then there is deoxygenated blood, which means oxygen is already provided to the cells, and in exchange, cells gave carbon dioxide to the blood. And in the deoxygenated blood, there is more carbon dioxide and a very little fraction of oxygen. That is why it is called deoxygenated, which means oxygen is removed from that blood. So that oxygenated, deoxygenated blood is returning from all over the body to the heart, and then it goes to the lungs. So that is where all the air exchange takes place. There are heart valves that are quite muscular, that contract and squeezes to pump the blood throughout the blood vessels. And there are different layers of heart walls as well. So you have three layers basically: endocardium, which is the innermost layer or lining of the heart. Then there is myocardium, this middle thick part of the heart, which contain muscles mainly. And then is epicardium, which is a very thin layer outside the heart that keeps it moist. So these three are the main layers of heart. Epicardium is also called pericardium, which means enclosing the heart, membrane enclosing the heart. So this was all about heart. We have ventricles, we have atria, we have different blood vessels entering and exiting the blood. We have read about the components of wall, which mean three layers of walls of heart. Then there is a bit more. These two ventricles are separated by a septum or a wall that is called interventricular septum, and then there is a septum between right atrium and left atrium, which is behind these two blood vessels. That is called interatrial septum. Moving to the next, there are heart chambers, which I already told you guys that there are right atrium, right ventricle, then is left atrium, left ventricle. Then there are heart valves. Basically, there are two types of valves: atrioventricular valves, semilunar valves. So atrioventricular valves literally mean the valves that connect the atrium and the ventricle. So these valves control the blood flow from one atrium to the ventricle of that side, and the other atrium and the ventricle of that side. So each side of the atrium is connected to the ventricle with the help of atrioventricular valves. These are two: tricuspid valve as well as mitral valve. So the valve between the right atrium and the right ventricle is called tricuspid valve, and the door between your left atrium and the left ventricle is called mitral valve. It is also called bicuspid valve. Then there are semilunar valves. Semilunar valves are actually the valves that are on the base of blood vessels. These blood vessels, this pulmonary trunk and this aorta. So these, this structure, this is called semilunar valve. These both are called semilunar valves. So basically, what is their purpose? Once the heart contracts, it squeezes this part. So what happens as a result? These valves close. The right atrium and right ventricular valve closes, and then left atrium, ventricle valve closes. So when heart squeezes, it applies all the pressure to push the blood into this vessel as well as in this vessel. So to avoid the reverse blood flow, these valves gets closed after each time the heart gets pumped and then it relaxes. When the heart relaxes, these valves gets closed to avoid the backflow of the blood that is just pushed by the heart into the systemic circulation. Systemic circulation, there are two type of circulation. Number one is pulmonary circulation. Number two is systemic circulation. Uh, Number one is pulmonary, which means this right part of the heart receives the blood from the periphery of the body, and then it pushes to the lungs from the right side. This ventricle pushes blood into the lungs to get more oxygen and to remove carbon dioxide. Meanwhile, this side of the heart, which is left atrium, the left atrium receives blood from the lungs, which is purified, which contains more oxygen, which doesn't contain carbon dioxide, which already gets removed because it is already passed by pulmonary circulation. So once the purified or oxygenated blood enters into the left atrium, it goes into the left ventricle through this mitral valve or bicuspid valve, and then this left ventricle pushes the blood to the all the blood vessels in our body, that including brain, our limbs, our heart, our vessels around the heart, our vessels for the digestive system, each and every blood vessel. So this is these are two type of circulations that work simultaneously. So we were talking about semilunar valves. Number one is aortic valve, which is at the base of aorta, and the other one is pulmonary valve. So aorta exits from the left ventricle. Meanwhile, the pulmonary arteries, pulmonary veins, sorry, pulmonary vessels. Let me clarify again, which we call it pulmonary trunk, which because it arises as a single vessel first, then it branches out to form two pulmonary vessels. So pulmonary trunk exits from the right atrium, meanwhile the aorta exits from the left atrium. So what type of blood vessels are in our body? There are arteries, there are veins, and there are capillaries. Usually, the arteries are present deep in our skin, within our muscles. Veins are very superficial. There are deep veins as well, but mostly veins, as you can see on the dorsum of your hands, on your medial side of your arm. So these veins are superficial. Then there are capillaries. So these are the capillaries. This is the vein. This is the artery. So this vessel uh, gets blood from the heart, which means when the heart pushes, these arteries carry blood away from the heart toward the body, and when it branches out, forms smaller and smaller and smaller vessels, and at the end it forms capillaries. And then capillaries have two sides. One is arterial side and one is venous side. So on the other side of capillary there is vein, which collects the blood when it has provided oxygen and nutrients already, and then it carries blood toward the heart again, and heart then pushes to the lungs for purification purposes. So this is how these three type of blood vessels work. Arteries carry oxygen rich blood from your heart to your body tissues. This exception is your pulmonary arteries, which go to your lungs. Okay. uh, all the arteries carry blood away from the heart except pulmonary arteries that contain deoxygenated blood toward the lungs for purification. Otherwise, all the arteries get oxygenated blood, and it carry blood towards the body away from the heart. Meanwhile, all the veins carry blood away from the limbs or toward the heart, except the pulmonary veins that carry oxygenated blood from lungs to the heart. Meanwhile, all the rest of the veins carry deoxygenated blood toward the heart. Only pulmonary veins carry oxygenated blood from the lungs to the heart. So these are the just two exceptions because of nature of their assignment, I would say. So make sure to remember this one. So capillaries are basically very small vessels. Uh, they are very thin and they are present at cellular level. So this is where cells exchange their nutrients and gases and water and everything at this level, at capillary level. There are a lot of capillaries in the fingertips of our body as well as on the toes. So wherever there is appendages or anything, there are a lot of capillaries because there is a junction of veins and arteries going to a blind end there. So whenever if you happen to do PSR, or if you happen to use a glucometer to check your blood sugar levels, you just you pinch your fingertip with a lancet. So blood well, blood pours out quickly and in a very short period of time because of their dense network of capillaries there, and there is a junction of uh, venous and arterial blood, so you get estimated your blood sugar by getting the blood from the fingertips. So this was all about the arteries, veins, and the capillaries. Next, there are different types of arteries. Let's go through their types just superficially. So mainly there are two types of arteries. One are elastic, one are muscular. So elastic have more elastic tissue than muscular arteries and located close to your heart. For example, aorta and pulmonary artery. So basically, the bigger vessels are more elastic and less rigid because whenever the heart pushes blood into the circulation, these vessels get relaxed to accommodate the blood pressure and to maintain the blood pressure in a normal range. So this is one of the homeostatic function of these blood vessels to maintain normal blood pressure. So that is why they are more elastic and less rigid to accommodate the blood pressure and to maintain it in the normal range. Then there are muscular arteries. They have more smooth muscle than elastic arteries, which means elastic arteries contain more elastic fibers, but less amount of muscle cells or muscle fibers. Meanwhile, the muscular arteries, by the name, they have more smooth muscle instead of more elastic tissue. So the arteries in our limbs have mainly muscular arteries because if they have elastic arteries, they would be squeezed easily because of our daily life movements. Because we usually flex and extend our arms, we flex and extend our hips, we flex and extend our toes and ankles. So if they happen to be elastic arteries in our limbs, they would be squeezed so easily and it would cut off the circulation. So muscular arteries are a little bit more rigid than the elastic arteries. They tend to maintain the blood flow even in our flexed limbs. So let's talk about the difference of arteries from the veins. So arteries basically take oxygen-rich blood away from the heart and distribute it to your whole body. And they have strong muscle walls that can handle high pressure of blood, and your heart pumps out with each heartbeat, which means arteries have more blood pressure as compared to the veins. If guys have noticed, we check blood pressure usually at by applying the cuff on the upper arm, and by upper arm we check blood pressure from the brachial artery, which is a big artery at the junction of our upper and lower arm, and it can be easily palpated next to the bicep tendon. So we take the blood pressure from there. We always take blood pressure from the arteries. We never take blood pressure from the veins because you already veins have already have very decelerated, I would say, blood pressure because they are returning the blood from the body toward the heart in a very slow manner. Meanwhile, the arteries contain blood at a very great speed at the pressure of 120 millimeter of mercury systolic blood pressure. So this is usually the normal systolic blood pressure. So one of the major differences that arteries have very high blood pressure as compared to the veins. By high blood pressure means doesn't mean abnormally high. I would say it is comparatively higher than the veins. Arteries don't need valves because the force of blood coming from your heart ensures the blood only goes in one direction. So the contraction of the heart is very strong that the blood doesn't even bother to look back or to go in reverse direction. It only moves forward direction. Meanwhile, the veins have like very slow blood pressure. They might have a tendency that the blood can go in reverse direction in the veins. So sometimes if a patient is already like have a cardiovascular issue and they are very sedentary, so there might be a possibility that they might have a blood pooling in their legs if they have been sitting for too long, or they might have edema. So this is how diseases manifest in a different type of cardiovascular diseases, especially if we talk about the vessels or vasculature. So veins bring blood back to your heart of your body cells and tissues have taken the oxygen out of it. This is known as oxygen poor blood or deoxygenated blood. They have thinner walls because the pressure inside them isn't as high as in arteries, as we already talked about. They have valves inside them to keep blood from moving in the wrong direction. Yes, arteries doesn't need valves because they have very strong blood pressure and blood doesn't tend to go back, or except only the base of aorta has a valve. Meanwhile, all of the veins or major veins have valves in between them, especially leg veins. So whenever blood tends to go back, these valves resist the blood to go in one direction. Plus, our body movement and the skeletal muscles squeeze the veins to apply pressure whenever we are actively walking or moving or changing our position. So skeletal muscles help the veins to return blood towards the heart. So this is how blood gets returned to the heart in a very slow pace. Next, there are circulatory pathways. We have already discussed about the pulmonary pathway as well as systemic pathway. In pulmonary, circulation transports oxygen poor blood from the right ventricle to the lungs, where blood picks up a new blood supply, which means uh, blood by new blood supply means by picking the oxygen from the air we inhale and to give away the waste of carbon dioxide towards the lungs, and then we exhale that carbon dioxide. So this is happening simultaneously all the time. Then it returns the oxygen rich blood towards the left atrium. Next is systemic circuit. This systemic circuit provides the functional blood supply to all the body tissues. It contains oxygen and nutrients to the cell and picks up carbon dioxide and waste products. So both of these pathways are happening simultaneously and uh, have to like synchronize with each other. If any of the circuit fails, definitely our whole circulation is going to collapse is are going to collapse. Systemic circulation carries oxygenated blood from left ventricle through the arteries to the capillaries in the tissues of the body. From the tissue capillaries, the oxygenated blood returns through a system of veins to the right atrium of the heart. I think we have like discussed these pathways in a very great detail, and I hope you guys have understood it well. Next are coronary arteries. So basically, coronary artery is the place where all the cardiovascular thromboembolic events takes place other than the stroke. So deaths due to the CVS is a very death toll is very high due to the CVS mortalities. So these are the vessels where things go wrong, and that part of hearts get fail to get oxygen and the nutrients, and that side of the heart where the blood supply is compromised, it start it starts to die, and then eventually the heart stops beating and pumping blood. So this is how the whole heart attack scenario comes in. So basically there are four major arteries that supply the heart itself. One of the major function is like to receive blood and to pump blood, but to keep going it has a self circulatory system as well that are called coronary arteries. There's left coronary artery, circumflex artery, left anterior descending artery, right coronary artery. So this one is right coronary artery. These both arteries arise from the base of aorta. This round thing is aorta, and these vessels arise from the base of aorta. So this is right coronary artery. It supplies on the right side of the heart, mainly the right atrium. Then comes the right marginal artery or acute marginal artery. It like there are whole different branches of the main arteries. Sometimes we name them if they are clinically important, but if they are clinically insignificant, we just simply say it's the branch that supplies this and that. So the right coronary artery supplies mainly a whole chunk of right atrium and a right ventricle and interventricular septum. Then there is left coronary artery that originates on the left side of the base of aorta. Then circumflex artery is a branch of left coronary artery that's branches out further and supplies to the left ventricle and as well as left atrium. So this artery, left anterior descending artery, is the most common place where a plaque gets stuck, or sometimes there is any CVA issue, which means most of the myocardial infarctions, or I would say heart attacks, take place because there is most likely there is blockage in left anterior descending artery. There can be possibility of blockages in other arteries as well, but most of the times, this artery is involved. Next are physiological properties of muscle. Physiological properties of muscle include rhythmicity, conductivity, contractility, excitability, all or none law, staircase phenomenon. So these are the properties we are going to discuss one by one. So number one is rhythmicity, which means uh, cardiac tissue has a capacity of its own to generate its own impulses regularly at intervals, a specific interval at 0.8 second. This property is known as self-excitation or autorhythmicity. Conductivity, the human heart possesses unique conducting system, which is constructed by specialized cardiac muscle fibers known as internodal fibers. These fibers are responsible for quick transmission of impulses from SA node to the parts of heart. So basically, uh, nerves from the nervous system of our body are a network throughout of your body. So basically, when the nerves reach heart, they form a condense, or I would say a cluster of nerves that are called SA node, sinoatrial node, that is present on uh, right atrium. So this is a junction where all the electric impulses get uh, into a regular, I would say, rhythm. Then it is spread to the uh, and atrioventricular junction, and then there are it is spread to the walls of the heart through the internodal fibers. So we will talk about in detail about the conduction system in the next slides. So this is how it works. So basically, once the electrical impulse or nerve impulse reaches the heart, it is spread into the heart in a very like systematic manner. First, it reaches to the atria, which means the two atrium, right and left. They contract, and then there is a very small or millisecond delay before the ventricles contract. So this is how electrical impulses reach from the top of the heart to the bottom of heart in a very systemic manner, allowing the heart to contract and relax in a organized manner. So when this system gets distorted, or whenever the nerve impulse system gets disorganized, we get arrhythmias, we get atrial fibrillation, and we get ventricular fibrillation, which is a very lethal emergency of the heart. Contractility of the heart muscle refers to its ability to shorten and contract in length in response to stimulus, which means contractile tissue have ability like heart muscle are contractile, which means they can contract whenever there is a nerve impulse. They can contract to squeeze itself and to push the blood into the circulation. And once it pushes the blood to the circulation, it relaxes, allowing to the blood to return toward the atria from the circulation. So this is how blood doesn't pool in our body. One way it pushes the blood, in another way it relaxes to get the blood pooled back. Then there is all and non law, which means cardiac muscle strictly obeys this law in accordance with law whenever a stimulus is provided, regardless of its entire strength, and the entire heart muscle either responds to it at its maximum capacity or there is no response at all. So whenever there is a nerve impulse to pushing the heart to contract or making the heart contract, even if a area of the heart is weak, or a certain area of other area is have a good strength, But instead, whenever there is nerve impulse, it simultaneously contracts regardless of its strength. So this is all or none. Either the heart contracts as a whole or it doesn't contract at all. Staircase phenomenon. When the heart muscle is excited with sequential maximum stimuli, the initial few contractions display a progressive increase in magnitude, which is referred to as staircase. Following that, strength of contraction stabilizes at its regular level. So whenever there is a phenomenon or anything uh, that makes the blood pressure or to drop or anything that decelerates the heart, like rest. So what happens when you start walking or start doing any strenuous exercise after resting? So there is a staircase phenomenon. First, there is a progressive increase in the contractions, and then there is a steady contraction state, which means you were resting and there was a contraction but at a low rate. Like there is usually 70 beats per minute is the normal heart rate, but whenever you are resting it is somewhat between 50 to 70. So it's okay if you have 50, if you have 60. So but when you get up and you start doing some work and that works get like harder and harder or strenuous, like you work and you walk to the gym and you start doing any heavy exercise. So this is how your heart rate changes. When you walk, your heartbeat starts going up, and when it starts progressing, it progresses to a normal level, like it goes from 50 to 70 from rest to the walking stage. And when you walk and you start doing heavy exercise, it uh, reaches to the maximum normal level, like 70 to 80 to 90 to 100 sometimes. But then it becomes steady unless you keep doing that exercise for too long. But usually people doesn't like bear that much heart rate for long. So even if there is a heavy exercise episode, it goes to 150 or even 200, then immediately it drops to the lower, I would say lower normal, like 70 to 100. So this is the staircase phenomenon, which means accelerating the heart rate to the normal and decelerating the heart rate to the normal whenever there is a need. So these were the properties of heart muscle. Then there is electrical conduction system. This was it was I was talking about it before. There is an SA node which is present in right atrium. Then there is an AV node. So this is a node where nerve impulses reaches first from the brain. Then it spreads out to the AV node, and from the AV node it spreads to the walls of the heart through the bundle of his, or also called uh, internodal fibers, I would say. So bundle of his then further spreads out to form small branches, right bundle branch and left bundle branch, Purkinje fibers. So this is how these nerves or nervous system or electrical conduction system is spread out through the heart to make our heart contract in a simultaneous and rhythmic manner. So there is SA node, then there is AV node, there is left bundle branch, and there is right bundle branch, bundle of phase, Purkinje fibers. So these are the fibers that spread out from the conduction system, and they are attached to the muscles that are attached to the valves. So this whole thing makes your heart to contract correctly in a I would say mechanical as well as electrical manner. So this is how these electrical as well as muscular part of the heart contracts and relaxes in a simultaneous and synchronized manner to push the blood and to get the blood from the periphery. Then there is cardiac cycle. Cardiac cycle is basically two phases, which means one phase is when the heart contracts, the other phase is when the heart relaxes. The phase of heart contraction, I would say, sorry, let's talk about atrial diastole first, which means the relaxation phase of the heart. So in this stage, chambers of the heart are calmed, I would say relaxed, that is when the aortic valve and pulmonary artery closes and atrioventricular valves open, thus causing the chambers of the heart to relax. Let me make it simple for you guys. First is atrial diastole, aka relaxed part of heart cycle or relaxation part of heart cycle, in which heart is very relaxed and it is allowing to get the blood pooled into the heart. The very next phase is atrial diastole, which means at this phase, blood starts flowing from atrium to ventricle, and this period atrium contracts. First, there is a pooling of blood in the atrium, then the atrium contracts and the pushes blood into the ventricles, and then the ventricles push the blood into the blood vessels. So this was the cardiac cycle. Then there is blood pressure. There is systolic blood pressure. There is diastolic blood pressure. I hope you guys are already familiar with these terms. Systolic blood pressure refers to the maximum blood pressure within the our large arteries when the heart muscle contracts to propel blood throughout the body. So this is the maximum blood pressure that is applied against the walls of the vessels by the blood when there is a contraction by the heart. Then next is diastolic phase. It describes the lowest pressure within the large arteries during muscle relaxation between the beating. So whenever there are two contractions, there is a relaxation phase in between the heart to allow it to fill with the blood completely. Then be ready it for to be ready for the next phase of contraction. So these are the systolic and diastolic blood pressure. So arterial pressure directly corresponds to the cardiac output, arterial elasticity, peripheral vascular resistance. So these are the factors that count when we are talking about the arterial pressure, or I would say systolic pressure. So cardiac output means the amount of blood pumped by the heart in 1 minute. Arterial elasticity means how much your blood vessels are healthy, which means your blood pressures by healthy means your blood vessels are allowing the blood pressure to stay within normal limit. Once they get rigid due to the lipid deposits or due to the aging or due to any other disease, arterial elasticity is reduced, thereby they do not act as a buffer, and blood pressure tend to go higher and higher. This causes hypertension. Then there is peripheral vascular disease, which means there are diseases that are associated with the peripheral blood vessels as well. In diabetes, you might have seen some people with diabetic foot or ulcers on the foot that are not healing. In that case, in diabetes, sometimes uh, the blood vessels of the peripheral arteries gets coagulated, or I would say gets clogged. So there is not enough supply of the blood towards the toes. So toes begin to deteriorate, and the lesions start to develop, and then the surgeons decide to cut off the foot. So this is how these diseases progresses due to these minor bases. Cardiac output is basically amount of blood that a healthy person or healthy heart pumps in 1 minute is termed as the cardiac output of the heart. So what decides the cardiac output? Basically, cardiac output is decided by the heart rate and the stroke volume. Heart rates mean number of beats per minute, and number of beats per minute is decided by the hormones and the nerves, which mean hormones can affect the heart rate, as well as our nerves can alter the heart rate as well. We have two type of nervous stimulations. One is parasympathetic, the other one is sympathetic. Sympathetic is fight or flight mode when we are scared, when we are angry, or whenever we are running or doing something very like strenuous or very stressful. So our sympathetic nervous system is on in that cases. So we have a high heart rate in that situation. Meanwhile, parasympathetic system is while when we are resting or we are eating. So in that case, our heart rate goes down a bit to the normal level. Then there are hormones. There are certain steroid hormones that make our blood pressure to go higher, but there are other blood vessels as well that relaxes the peripheral arteries and allow the blood to circulate more, and it reduces the blood pressure. Then there is stroke volume, which means amount of blood per beat or per contraction. Stroke volume is defined by the blood volume, the amount of circulating blood, as well as vascular resistance. So let me make it simple for you. If there is a lot of blood in the person's body, uh, that is going to cause us good stroke volume. So we are calculating heart rate and stroke volume to calculate the cardiac output. Stroke volume, if we talk about the blood volume means the amount of circulating blood if we are adequately hydrated and if we have a good hemoglobin levels. So whenever there is a drop of hemoglobin level, or if there is trauma and there's incidence of bleeding or heavy bleeding following delivery or anything, so there's a lot of blood loss, which means there is a decreased blood volume. So decreased blood volume means there is decreased stroke volume. Decreased stroke volume means there is decreased cardiac output. So this is how these things are related. The next one is vascular resistance. Vascular resistance means the amount of arteries that get triggered or in response to the blood pressure if there is any disease. So if the vascular resistance is less, they have wide boards, which mean arteries have wide board. So which leads to the low stroke volume because blood is widely distributed through the wide boards. And if there is a more vascular resistance, there are narrow bores or narrow diameters of the arteries, which leads to the high stroke volume because blood is pushing against the very strong, or I would say non-elastic arteries, and there is a high vascular resistance, which means blood is circulating in a very narrow vessels. So that leads to stroke volume. So we have discussed about the factors that might increase or decrease the heart rate, that might increase or decrease stroke volume. So overall, heart rate and stroke volume decide the cardiac output. Now we are going to talk about the cardiovascular diseases. Number one is angina pectoris. Uh, this one is very common, especially the people who suffer from heart attack. They suffer this pain before. This pain is called angina pectoris. Angina means a spastic pain in the blood vessel of the heart because we are referring to it. Then there is pectoris, which is referring to the pectoral muscles, which are our chest muscles basically, or left side of the left side. So whenever there is incidence of ischemia or reduced blood supply to the heart, or if there is an imminent heart attack, the person experiences an angina pectoris, which means a very severe sharp pain in the chest on the left side mostly. It is caused by lack of oxygen supply in the myocardium. Myocardium is the middle layer of the heart, which contains muscles. These are three clinical distinct types of angina pectoris. We are not going in detail, but we will talk about the names. Number one is stable or typical angina. It is most common type of angina, which is which only triggers when there is a nerving in the uh, blood vessel or coronary artery. So whenever there is an emotional stimulation or a physical exercise or a heavy exercise, then heart requires more blood, but the narrowed blood vessel due to any deposit of lipid or nerving, it is not allowing enough blood to go to the heart because heart requirement is high. So this causes a crisis, which is stable or typical angina. So if the person stops heavy exercise and then the pain alleviates, which mean it is a situational type of chest pain. Then there is Prince metal variant angina, which means pain at rest characterizes this type of angina, which is unrelated to the physical exertion. So in this type of angina or chest pain, uh, the person can still feel the pain even at rest. So Usually it is related to the vasospasm, which means contraction of blood vessels that are supplying the heart due to any reason, due to I would say unrecognized reason, or if there is any allergic reaction. Sometimes mast cell stimulated release of humoral vasoconstrictors in the coronary adventitia. Okay, what happens if there is any anaphylactic shock? Sometimes there might be mast cells. Mast cells are type of white blood cells, or I would say eosinophils that get stimulated and they release certain vasoconstrictors. Vasoconstrictors are the chemical substances that make the arteries or the veins contract and make their lumens or their diameters narrow. So these can be induced by these reasons, which means due to sudden coronary vasospasm, due to due to any reason, I would say, and or due to any kind of anaphylactic shock or mast cell stimulated release of humoral vasoconstrictor. Then there is unstable or crescendo angina. It is a very severe form of angina. It is marked by great recurrence of pain onsets that last longer and occur more frequently during the rest. And this type of angina usually converts into myocardial infarction. So this unstable and Prince metal angina both are red flags, but unstable is a very I would say it should be dealt as soon as possible in emergency settings because unstable angina is usually very imminent situation to the heart attack. So it's a warning sign of oncoming myocardial attack and should be handled seriously. The next is disease is myocardial infarction. It refers to the occurrence of heart attack. So MI takes place when the blood ceases to flow adequately to a segment of heart. So which causes injury to the heart muscle due to deficit of oxygen delivery. So let's talk about what causes the reduced blood flow. This is a normal artery with a normal lumen, I would say normal diameter. Then there is atherosclerosis. Atherosclerosis means deposition of lipid or any other substances in the lumen of the blood vessel, which causes the narrowing of blood vessel. So once there is a narrowing of the blood vessel, there might be any incidents that this plaque can be dislodged and it goes into circulation and gets stuck in somewhere like if in the circulation of brain it causes stroke, and if it gets stuck in the coronary arteries it leads to the myocardial infarction. So this is how blood ceases to flow adequately to a segment of heart, which causes death of that segment of the heart due to the decreased oxygen delivery or not delivery or non-delivery of oxygen at all. So one of the coronary vessels that supply the heart with blood becomes blocked due to unstable deposition of cholesterol, white blood cells, plaques, and fat. So when the stimulation becomes more, situation becomes very, I would say, serious or more critical. It is referred to the acute myocardial infarction AMI, which means that is a very serious emergency that the heart is going to collapse and the patient is going to die. So myocardial infarction is a very serious emergency. So if there is a major vessel involved, that might lead to the immediate death of the patient due to the immediate cease of the blood flow to the brain. Then there is coronary sclerosis or atherosclerosis, which means a accumulation of plaque in the inner lining of artery results in condition known as arterial hardening or thickening. So this is a disease that is called by lipid more more circulation of lipids in our blood as well as aging and other factors. So when fatty materials, calcium, fibers, and events build up in the intima of an artery, which means inner lining of the artery, is known as atherosclerosis or coronary sclerosis, which means deposit of fatty materials along with the fibers or anything else. So this is how atherosclerosis develops. First, there is a plaque, then there is a progression. Once the plaque is formed, then the growth and the rupture, which means the plaque gets ruptured and it gets lodged into the blood supply. And if during the rupture there is injury to the lining, then the blood, uh, then the inner lining bleeds into the lumen, and then the blood starts clotting within the vessel. So this is how the blood vessels clogs completely and reduces or ceases the blood supply. So this is the arrhythmia. Sorry, I have to take an important call. Just give me 2 minutes. Sorry. Sorry for the interruption. Let's talk about the arrhythmia. So cardiac arrhythmias are a form of irregular heartbeats. So initially we were talking about the physiology of the heart, then we talked about the anatomy of the heart, and then we talked about the pathology. So whenever there is arrhythmia, which means irregular heartbeats that are either too low, which is called bradycardia, or too fast, that is called tachycardia. So arrhythmia is another very serious condition in which a person may or may not have any chest pain, but they might feel something is wrong with their heart. Arrhythmias are usually can be easily picked by the ECG and usually presented with the shortness of breath, chest pain, or sometimes without chest pain, exhaustion, and even unconsciousness due to reduced heart pumping capacity. So there are atrial arrhythmia, there are as well as ventricular. So the atrial part of atrial type is not very serious one, but the ventricular arrhythmias are very fatal and can be lethal if not addressed correctly. So ventricular fibrillations lead to uh, when there are inappropriate contractions, or if there are too much contractions that doesn't allow the heart to fill completely, or if there is heart filled completely, there are not I would say enough gap between the contractions, or there are too much contractions that are like I would say very weak, and they are not pushing the blood to the circulation. So this is how we describe arrhythmia. So arrhythmia can be in a very slow speed of the heartbeat. It can be on a very high speed, which means uh, the rate of contraction of abnormal heart rate can be very fast. That would be tachyarrhythmia. If the speed of the abnormal rhythm of the heart is slow, that would be bradyarrhythmia. So there are other types as well: extrasystole, atrial fibrillation, auricular flutter, ventricular flutter. We are not going into detail, that are out of scope of our lecture. So these are different types of the arrhythmias that can be easily picked by the ECG or electrocardiogram or EKG, I would say. Then there is hypertension. Hypertension is called when the blood exerts excessive force against the walls of the blood vessels. Usually the blood pressure is, I would say, 120 by 80, but there is a normal range. 110 to 125 is okay as a systolic blood pressure, and 60 to 80 or 85 is normal diastolic blood pressure. So whenever there is a high blood pressure, the situation would be called hypertension. But if there is low blood pressure, that would be called hypotension. So the most severe form of hypertension is called chronic hypertension, which is asymptomatic and silent killer. It can only be picked if sometimes patient have severe headache or might have blurring of vision or have sudden issue of kidneys, or if they have like developed any kind of stroke or anything. So this is how it is picked, but usually it remains silent and non-symptomatic. So if it stays for too long, it can lead to the retinal damage to the retinal blood vessels, brain damage, kidney failure, and atypical thickening of cardiac muscles. Heart failure. So there is difference between heart failure and heart attack. Heart attack is a situation that is acute and occurs within hours or minutes. Heart failure can range from months to the years. So heart failure means pathophysiological condition with defective heart function is incapable of maintaining optimal circulation for metabolic needs of the body, which means heart muscle is very weak and it is unable to push blood. So congestive heart failure means there is reduced volume of oxygen-rich blood pumped to the body, which means dilated ventricle. So that lead to the swelling in the legs and feet. That swelling would be called edema, and that edema is specifically pitting edema. When we press with the thumb against the uh, ankle joint of this kind of patients, it stays. And if we press the ankle, uh, the swelling on the ankle and lift our thumb, but that depression stays for like half a minute or minute. So this would be pitting edema in case of congestive heart failure. So there would be fluid buildup in the lungs and there would be shortness of breath. Then there would be enlarged heart and chest congestion. So in short, there would be pooling of blood because heart is failing to pump the blood. So overall, the blood starts to get pooled in the legs, in the lungs, as well as in our body cavities. Valvular heart disease. So basically, there are two types of valve diseases. One is in which stenosis. Uh, Stenosis mean the valve stays closed for too long, even if in the normal time. So if the valve has to open up, but it doesn't open as per normal, so that would be stenosis. And there is a condition that would is called regurgitation, in which valves are malfunctional and they are not functioning properly and they does not close adequately. So whenever there is I would say contraction of the heart, blood is pushed and then uh, it is reversed back to the heart again. So these two are also very lethal disease of the heart. So in that case, either the valves are repaired or synthetic valves are implanted. So this was all about the lecture. If you have any questions, please feel free to ask.
Thank you.